I started skating at the age of 6, and then I tried hockey at 7 years old. I would grow up watching the Montreal Canadiens a lot, and I guess I kind of fell in love with the sport. I got injured playing flag football, and I had the ball and fake one way, went to the other way, and something popped in my knee. And then I figured it was my meniscus and my ACL torn.
Knee injuries can range from, a very simple sprain or a contusion to a single ligament injury like an ACL or even MCL injury. Women are anywhere from 2 to 8 times more likely to tear their ACL, and that's biomechanical sort of factors that play into that, as well as hormonal factors.
And at the time, I didn't really want to have the ACL surgery to not be off the ice for too long.
Knee injuries can really range from, you're missing no time from competition to, 9 to 12 months, which is how long it takes to get back from an ACL reconstruction.
And when I got to UConn after my freshman year, that's when I decided to have the surgery for my ACL.
We knew that probably for the longevity of her knee, it was going to be best to make her a more stable knee, and that would be with an ACL reconstruction.
I think just with the NCAA, the level of physicality is pretty high. It was just to prevent any major injuries, to just get my knee fixed up and healthy.
Yeah, I think it's important to know when to seek care and medical care when you have a knee injury. If you can't put weight on it, if it swells up after 24 hours, if you hear a pop or your knee feels unstable, those are all things that, I would reach out to an orthopedic surgeon. Not everything can be prevented, but we do know ACL specifically, there are some prevention methods in regards to, especially in women, how we jump and land. By nature, female athletes are more quad dominant, so having a better strength relationship between your hamstrings and your quads can sort of prevent some of those injuries. So a lot of our strength and conditioning with UConn athletes and as well as in the community are really focused on jump, landing, and strengthening.
I've been working a lot on my quad strength, just doing extra reps. We have this BFR tool here, and it's helping with gaining strength again.
BFR is blood flow restriction, where we basically put a device on the leg that's similar to a tourniquet, and it partially restricts the blood flow. And then you basically do low resistance workouts for your quad strengthening. It somewhat tricks your body into thinking that it has a higher load and a higher resistance, so you see a lot of increased strength gains. Athletes don't love because it's not the most comfortable, but they see the benefits of it very quickly.
Before I got surgery, I could feel sometimes my knee wasn't as stable as I would like. And ever since the surgery, it's definitely more stable.
Meghane has made a full recovery. She is very focused and determined, and she's back to competing at the highest level.
It's good to be able to play and not have to worry about my knee, and I just feel safer out there on the ice.